Good morning, all of you. I am Mahendra Saini, Assistant Professor, Department of Pharmacy, Suresh Gyan Vihar, University. Today, I will discuss about the topic is principles of cancer. Principles of cancer. First of all, today I will discuss the learning objectives of this topic. Learning objectives of this topic. Based on the content in this chapter, the reader should be able to like introduction of cancer, symptoms of cancer, and next one is types of cancer and properties of cancer and treatment of cancer. These are the learning objectives of this topic. Next one is learning outcomes of this topic. By the end of the lecture, the student should be able to understand like introduction of cancer, symptoms of cancer, and types of cancer, properties of cancer, and last one learning outcome is treatment of cancer. These are the learning outcomes of this topic. Next one, first of all, discuss about the introduction of cancer. Cancer is the uncontrolled growth of abnormal cells anywhere in the body. It means cancer cells. Uncontrolled growth of abnormal cells means cancer cells. And next one is it is also called malignancy. It is also called malignancy. Cancer also called malignancy. Malignancy is the state or presence of a malignant tumor cancer. Next one is causative agents. Causative agents of cancer like chemical, toxic compounds, exposure, toxic compound exposures, and ionizing radiations, and some pathogens. These are the causative agents of cancer and cancer caused by the chemical, toxic compound exposures and ionizing radiations and some pathogens. Next one is most cancer cell, most cancer from tumors, but not all tumors are cancerous. Most of cancers from the tumors, but not all tumors are cancerous. Next one is symptoms of cancer. Cancer symptoms depend on the types. Cancer symptoms are depend on the type of cancer like carcinoma cancer, myeloma cancer, sarcoma cancer, and general symptoms are like fatigue, weight loss, pain, skin changes, unusual bleeding, and persistent cough, fever. These are the symptoms of cancer. Next one is types of cancer. Types of cancer. According to National Cancer Institute, give the common types. National Cancer Institute gives the common types like bladder cancer, breast cancer, endometrial cancer. Fourth one is leukemia. Fifth one is pancreatic cancer. Sixth one is thyroid cancer. Seventh one is lungs cancer. Eighth one is melanoma cancer. And ninth one is kidney cancer. And 10th one is lymphoma cancer. And 11th one is prostate cancer, and last one is colon and rectal cancer. First of all, discuss the bladder cancer. Bladder cancer, cancer that brings in the bladder, and breast cancer, a cancer that's formed in the cell of the breast, and endometrial cancers means uterine cancer, a type of cancer that brings in the uterus. And next one is leukemia cancer, a cancer of blood forming tissues and hindering the body ability to fight infections. And next one is Pancreatic cancer. Pancreatic cancer that brings in the organ laying behind the lower part of the stomach means pancreas. And next one is thyroid cancer. Thyroid cancer, a cancer of the thyroid, the butterfly shape gland at the base of the neck. And next one is lungs cancer, a lungs cancer that's being in the lungs and most often occurs in people who smoke. And next one cancer is melanoma cancer. It is the most serious type of skin cancer. Melanoma cancer is a type of skin cancer. And next one is kidney cancer. In adults, renal cell carcinoma is the most common type of kidney cancer. And next one is lymphoma cancer. A cancer of the lymphatic system means lymphoma cancer. And prostate cancer, a cancer in a person, man prostate and small walnut sized gland that produce seminal fluid. And last one type is cancer is colon and rectal cancer, a cancer of the colon or rectum and located at the digestive tract lower end. And next one is this is the this is the brain metastasis, and this is the skin melanoma, and this is the lungs metastasis, and this is the pancreatic cancer, and this is the example of primary and where they can metastasis spread to by the deoxygenated blood and bone metastasis, and this is the lungs cancer and adrenal gland metastasis and liver metastasis, and this is the colorectal cancer. Colorectal cancer metastasis is a spread to other sites in the body by metastasis. Next one, the most common cancers in men's and women's and children's. The most common cancers in men like prostate cancer, lungs cancer, and colorectal cancers. And next one is most common cancers in women's like breast cancer, lung cancer, and colorectal cancers. And last one is children. Most common children's cancers like leukemia, brain tumor, and lymphoma. These are the most common type of cancers in men, women, and children's. Next one is carcinoma. Next one is carcinoma. Begins in skin in tissues and that line the internal organs like skin, lung, colon, and pancreatic, etc. And subtype of carcinoma like adenocarcinoma, basal cell carcinoma, and third one is squamous cell carcinoma, and last one is transitional cell carcinoma. And first one is adenocarcinoma is a type of cancer. Adenocarcinoma is a type of cancer that start in mucus producing glandular cells of your body, and mucus producing glandulars means goblet cells. Next one is basal cell carcinoma. Basal cell carcinoma, a type of skin cancer. Basal cell carcinoma is a type of skin cancer that begins in the basal cells. And third one type of carcinoma is squamous cell carcinoma, in which squamous cell carcinoma is the second most common form of skin cancer. Second most common form of skin cancer is squamous cell carcinoma. Last one is transitional cell carcinoma. Transitional cell carcinoma is also called urothelial. Urothelial carcinoma is a type of cancer that typically occurs in the urinary system. Next one is sarcoma. Sarcoma cancer begins in bone, cartilage, and other connective tissues. The sarcoma cancer is two types. First one is bone sarcomas, and second one is soft tissue sarcomas. These are the types of sarcoma and connective tissue. Bone sarcoma means are primary bone tumors. Bone sarcoma are primary bone tumors, which means that they start in the bone and they are usually found in children's. And next one is soft tissue carcinoma. Soft tissue carcinoma, sarcoma is a broad term for cancer that start in soft tissue like muscles, tendons, fat, and lymph and blood vessels and nerves. These are the types of sarcoma. Next one is leukemia. The next one is leukemia. Leukemia leukemia cancer begins in blood forming tissues. Leukemia cancer begins in blood forming tissues and causes large number of abnormal blood cells and enters the blood. And next one is age between 0 to 5 and 14 to 18 and 19 to 40 and 60 plus, and subtypes of leukemia like lymphoblast leukemia, and next one is T cell leukemia. Lymphoblast leukemia, a type of cancer of the blood and bone marrow that affect white blood cells, means lymphoblastic leukemia. And next one is T cell leukemia. T cell leukemia is the highly aggressive mature T cells neoplasm and associated with human T cells and lymphotropic virus type HTLV1. HTLV1 means human T cell lymphotropic virus type first infections, and which affect around 10 million people in the world. And next one is lymphoma and myeloma cancer. Lymphoma and myeloma cancers start from white blood cells, means start from leukocyte cells, and affect lymph nodes of specific site like stomach, brain, intestine. These are the sites of lymph nodes affected by the lymphoma and myeloma cancers. Myeloma means a cancer of plasma cells. Myeloma means a cancer cell of plasma cells, and lymphoma a cancer of the lymphatic systems. The two types of first one is B cell lymphoma, B cell lymphocytes, and second one is T cell lymphocytes. First one is B cell lymphocytes, and second one is T cell lymphocytes. Next one is first one myeloma cancer. Beginning begins myeloma cancer begins in plasma cells and type of blood cancer. Myeloma cancer is a type of blood cancer, and plasma cells are capable of producing various antibodies. Plasma cells are capable of producing various antibodies, and it can damage cell counts. Myeloma cancer damage the bone, kidney, and red blood cell count. Next one is central nervous system cancer, CNS system. CNS cancer start with brain tissue and spinal cord. CNS system start from CNS cancer start with brain tissue and spinal cord, and the brain control the body and the brain control the body by sending electrical messages along nerve fibers. And next one is brain and spinal cord. Brain and spinal cord from the central nervous system. Next one is normal cell division, and another is cancer cell division. Compared to normal cell division, cancer cells are uncontrolled and fastly grow. Like this is the cancer cell division and this is the normal cell division. And this is damaged cell and apoptosis. Apoptosis is the process of programmed cell death. Apoptosis means cell death. Next one, normal cell and cancerous cells. Difference between normal cell and cancerous cell. This is the normal cell growth procedure, and this is the cancerous cells growth pattern, in which normal cell and cancerous cells, like many cells that continue to grow and divide. Many cells that continue to grow and divide, and variations in size and shape of cancerous cells. Cancerous cells grow and divide continuously, and variation in size and shape of cancerous cells, and nucleus that is large and darker than normals, in which cancerous cells nucleus that is large and darker than normal. Next one, the abnormal number of chromosomes. Abnormal number of chromosomes arranged in disorganized fashions. And last one, the cluster of cells without a boundary, in in which cancerous cells cluster of cells without a boundary. This is the difference between normal cell and cancerous cells development. Next one is role of cell division in cancer. Role of cell division in cancer, like top of top is the normal cell division, like cell damage, no repair means apoptosis. After cell damage, no repair means apoptosis conditions. And next one is bottom, cancer cells are uncontrollably growth, and this is malignant tumors and metastatic tumors and beginning tumors, in which malignant means malignant means that the tumors malignant means that the tumors is made of cancer cells and it is invade nearby tissues, some cancer cells. And next one is metastatic cancers, in which metastatic cancer cells break away from where the first formed primary cancer and blood travel through the blood or lymph systems, and from new tumor means metastatic tumors in other part of the body. And next one is if tumors, malignant tumors, if tumors surrounding tissues cancerous, and in which metastatic cancer, if individual cells breaks away and start a new tumors less rare cancers. And Beginning with tumors has no effect on surrounding tissues means non-cancerous. These are the role of cell division in cancer. Next one is spread of cancer. Spread of cancer. The primary and secondary cancer. First of all, the place where a cancer starts in the body is called primary cancer. First of all, cancer start in the body. The place where a cancer start in the body is called primary cancer, and these are spread to other parts of the body. These are spread to other parts of the body. It means this can form other tumors also are known as secondary cancer. First of all, cancer start in the body are called primary cancer, and after that, primary cancer cause travel to other parts of the body. It means secondary cancer. Next one is secondary cancer in the liver that has spread from the bowel, and primary cancer in the bowel. In this figure, show the cancer in bowel. It means primary cancer, and after causing primary cancer, travel by the blood cause secondary cancer in liver that has spread from the bowel. Spread to other areas of body. Spread to other areas of body means it can spread to other parts of the body. It can spread to other parts of the body through the bloodstream and lymphatic system. Two systems are involved in the spreading of cancer. First one is bloodstream system, means circulatory system, and second one is lymphatic system. That systems are responsible for the spreading of cancer one part to another part. Next one, in order to spread some cells, in order to spread some cells from the primary cancer and must break away and travel to another part of the body and start growing there, in which spread to other areas means cancers travel to another part of body and start growing there, and some are going to blood vessels means some are going to blood vessels, also known capillaries. Next one, spread through blood circulation. First one, spread through blood circulation. When cancer cell go into the small blood vessels, when cancer cell go into the small blood vessels and get into the bloodstream, they are called circulation tumor cells. They are called circulation tumor cells, and this can stuck somewhere in very small blood vessels. This can stuck somewhere in a very small blood vessels such as capillaries, move through the wall of capillary and into the tissue of the organ. It means also known as spread through the blood circulation. Next one, they can multiply to form a new tumors. They can multiply to form a new, they can multiply to form a new tumor. In this diagram, cancer cell is stuck in a small capillary. Cancer cell is stuck in a small capillary and capillary wall is one cell thick. The capillary wall is one cell thick. Next one is spread through the lymphatic system. Spread through the lymphatic system. The lymphatic system is a network of tubes. Lymphatic system is a network of tubes and glands. The lymphatic system is a network of tubes and glands in the body that filter body fluid and fight against, because lymphatic system is responsible for the fighting of foreign bodies and bacteria and virus. And cancer cell go into lymph vessels. Cancer cells go into lymph vessels and travel into nearby lymph glands and grow to form tumors in lymph nodes. Next one is properties of cancer cells. What are the properties of cancer cells? First one, it shows uncontrolled mitotic division. Uncontrolled mitotic division of cancer cells. First one property is cancer cells means uncontrolled the growth of mitotic division, and due to uncontrolled growth, due to uncontrolled growth, tumor is formed. Due to uncontrolled growth, tumor is formed and they are less adhesive than normal cells. They are less adhesive than normal cells. Compared to normal cell, cancer cells are less adhesive. And mitotic division. Mitotic division is a process of nuclear division in eukaryotic cells that occurs when a parent cell division to produce two identical daughter cells. And adhesive. Adhesive means a substance used for Adhesive means a substance used for sticking object or material together, glue. And next one is they are less adhesive than normal cells and they exhibit numbers of alterations and lack differentiation. Lack of differentiation is Lack of differentiation is considered a hallmark of aggressive malignancies. For example, differentiate leishomyosarcoma leiomyosarcoma from leiomyomas, and they lose ability to communicate. They lose ability to communicate with other cells. The cancer cells are lost the ability to communicate with other cells. Next one, they lost sensitivity. Cancer cells are lost the sensitivity and they lose adhesion molecules. Cancer cells lose the adhesion molecules and it is an genetic disease. It is an cancer cell Cancerous disease is a genetic disease like inherited cancers and sporadic cancer. Inherited cancer and sporadic cancer. Inherited cancer, a type of inherited disorder in which there is a higher than normal risk of certain types of cancers. And inherited cancer syndrome are caused by mutation changes in certain gene passed from parent to children. And second one is sporadic cancer. Sporadic cancer that occurs in people who do not have who do not have a family history and of that cancer or an inherited changes in their DNA that won't increase their risk for that cancer. Next one It can involve change in gene expresses. Cancer cells are involved in involve changes in gene expressions and lack of contact inhibition. Lack of contact inhibitions and loss of limitations on the number of cell divisions. Loss of limitations on the number of cell division and ability to grow in culture. And angiogenesis. Angiogenesis is the formation of new blood cells. Angiogenesis means formation. Angiogenesis is the formation of new blood cells. Next one. This is the difference between normal cell and cancer cell culture, in which positive growth factor and disease negative growth factors are both factors are working normal cell culture, and cancer cell cultures involve the individually growth positive growth factor and negative growth factor, but in which cancer cells positive and negative growth factors are work with and cell divided uncontrolled. Next one, treatment of cancer. Treatment of cancer. First of all, the treated by the chemotherapy. Chemotherapy is the use of drug, in which chemotherapy the use of drug to destroy cancer cell, and it usually works by keeping the cancer cells from growing, dividing and making more cells. And because cancer cells usually grow and divide faster than normal cells, means chemotherapy is more of an effect on cancer cells. And next one treatment is radiation, in which radiation therapy, also known as radiotherapy, and radiotherapy is a cancer treatment that the that use high dose of radiation to kill cancer cells and shrink tumors. And next one is surgery. Can surgery remove the tumors and nearby tissues during on operation? And next one is journal terms like benigns and means non-cancerous tumors, and malignant cancer means cancerous tumors. Non-cancerous tumors means soft tissue tumors is a growth that does not spread to other parts of the body. And non-cancerous tumors non-cancerous tumors are not usually life-threatening. They are typically removed by surgery and do not usually come back and rarely. And cancer is a disease in which cell almost anywhere in the body being to divided uncontrollably, and tumor. A tumor is when this uncontrolled growth occurs in solid tissue such as organ, muscles, and bones. Next one. These are the references. These are the references. First one reference is Clinical Pharmacy, 10th edition, 2010 by P.N. Bennett. And second one reference is Clinical Pharmacy and Therapeutic, 5 Therapeutics, 5 September 2011 by Roger Walker, Catavithlesia. Third one reference is pharmacotherapy, pathophysiological approaches, Dipro, 7th edition, and fourth one, essentials of medical pharmacology, Kadi Tripathi, 5th edition, and next one reference is basic and clinical pharmacology, Patram G, Cat Jones, 11th edition, And next one reference is Ragandel Pharmacology 6th edition. And seventh one reference is Pharmacology and Pharmacotherapeutics R.S. Sotakar 20th edition. Next one, multiple choice questions, MCQs, multiple choice questions of this topic. Question number first is across the globes. Across the globes is the most common type of cancer that kills men. Option A is lungs cancer. Option B is prostate cancer. And option C is penile cancer, and option D is oral cancer. The right answer is A. Across the globe, lungs cancer is the most common type of cancer that kills men. Next one question. Next one question is worldwide blank is the most common cancer that kills humans. The option A is stomach cancer, option B is skin cancer, and option C is ovarian cancer, and option D is breast cancer. The right answer is D, breast cancer. Worldwide, breast cancer is the most common cancer that kills women. Next one question. Fill in the blanks is the most common form of cancer in all humans. Is the most common form of cancers in all humans. Option A is brain cancer, option B is leukemia, and option C is skin cancer, and option D is colon cancer. The right answer is C. Skin cancer is the most common form of cancer in all humans. Next one question. Which of the virus below cause cancer resulting from chronic infection? Option A is herb simplex virus HSV. HSV means herb simplex virus, and option B is HPV, human papilloma virus, and option C is hepatitis B virus, and option D answer B and C. The right answer is D, both B and C. Human papilloma virus and hepatitis B virus cause cancer resulting from chronic infection. Next one question is what kind of food are linked to colon cancer? What kind of food are linked to colon cancer? Option A is processed meats, and option B microwavable foods, option C food with salt substitutes, and option D shellfish. The right answer is option A. Processed meats are linked to processed meats are linked to colon cancer. Next one question. Fill in the blanks is the most deadly of all cancers of the female reproductive system. Option A is uterine cancer. Option B is vaginal cancer. Option C is cervical cancer. And option D is ovarian cancer. The right answer is ovarian cancer is the most deadly of all cancers of the female reproductive system. Next one question. Across the globe, is the most common type of cancer that kills men? The right answer is A. Oh, option A is lungs cancer. Option B is prostate cancer. And option C is pineal cancers. And option D is oral cancers. The right answer is A. Across the globe, lungs cancer is the most common type of cancers that kill men. Next one question. Worldwide, fill in the blanks is the most common cancer that kills women. And the right answer option A is stomach cancer, and option B skin cancer, and option C ovarian cancer, and option D breast cancer. The right answer is D, breast cancer. Worldwide, breast cancer is the most common cancer that kills women. Next one is Next one question. Which of the virus below cause cancer resulting from chronic infections? Option A is herpes simplex virus. Option B human papilloma virus. And option C hepatitis B virus. And option D both B and C. The right answer is D, both B and C. Human papilloma virus and hepatitis B virus cause the chronic infection. Next one question. What kind of food are linked to colon cancer? Option A is processed meat, and option B microwavable foods, and option C food with salt substitutes, and option D shellfish. The right answer is A. Processed meats are linked to the colon cancer. These are the multiple choice questions regarding to this topic. Thank you. Thank you all of you for a wonderful session.